Hi there, and I'm Gina Cornett. I am the creator of the Revenue Cycle Decoded YouTube channel. And today we're having sort of a lunch and learn with Gina. So I want to talk to you today about checking your payer policies. So you should be aware of how important it is to check your payer policies, whether for Medicare patients, it's your national coverage determinations or your local coverage determinations and the local coverage articles. Remember, those two go together, your local coverage determinations and your local coverage articles, which provide additional information with your local coverage determinations. Um, and whenever you are providing a service or procedure, especially if it's something that's new to your office, you want to make sure that you have checked the payer policies to see if it's something that is going to be covered and you're going to be reimbursed for when you provide it. Of course, you always want to check your plan to see whether it is actually going to cover the service for the patient in the first place. For example, you want to make sure specialty service, say physical therapy, is within the coverage of your patient's plan. That's part of your front office doing their due diligence on insurance eligibility and verification of benefits. However, let's say that your physician has just met a new vendor for a product that has just come out or recently been approved. And now the vendor is showing up in your office having these conversations with your physicians. And I think there's probably not a practice or a hospital outpatient department out there or physician that doesn't get these types of calls from the vendors every day. So let's say your vendor has come in with a brand new product and your doctor is really excited to use it. Before you start putting that product on patients or you start performing that procedure or doing that service, you want to check the payer policies. And the first ones to check, of course, would be CMS to see if there is a national coverage determination or a local coverage determination that speaks to that particular procedure or service or product or device. The reason being that if there is a policy, you want to make sure that you know the requirements for the documentation, for the coding, under what circumstances the patient is going to be covered, when is it considered medically necessary, which CPT and HCPCS codes should be used, which medical diagnosis, ICD-10 codes are going to meet medical necessity, and what needs to be included in the documentation. So I'll take an area that I am very, very familiar with, which is skin substitute applications. Let's say that you are working for a podiatrist and the vendor has come by with the latest, greatest skin substitute out there. It's going to cure everything, right? It seems like that's almost always what they say. This is going to be so great for your patients. It's better than everything else. So your doctor is all excited. He wants to try this new skin substitute on his patients. And you may check your local coverage articles or you check Medicare for the currently covered skin substitutes or the skin substitutes that have a HCPCS code. And you see that this new product is on the list and the application codes 15271 through 15278 are covered. You know that, okay? And so your physician applies the product and does the procedure on this patient. You get paid by Medicare on your claim, no problem. Now you have a patient with a different Medicare or a different policy, let's say a commercial policy, Aetna, Blue Cross, one of the other commercials. And your physician wants to use the same product on the patient and he applies the product, does a skin substitute application, does the product, does the procedure, and you submit the claim to the payer, but now you get a denial. And it's a denial that tells you that the service is not covered. And you think, well, wait a minute, we've done skin substitute applications, or we've done this particular procedure. Think in terms of your particular specialty. You may be thinking, we've done this procedure and sent the claim to this payer before and got paid. Why aren't we getting paid now? Did you check the policy? because I can tell you, I can't tell you how frequently it is that I have seen a practice put on a product or perform a procedure and they didn't check the payer policy, which may have allowed it under certain circumstances, but under other circumstances or with a slightly different product, different HCPCS code, different procedure code, it's considered experimental. And if you didn't check the policy, you wouldn't know that. Even if you had tried to get an authorization before you did the service of the procedure, sometimes you'll do that. You'll send in the request for the authorization. You'll get back a response that says no authorization is necessary. If you don't take that extra step to check to see if there is a payer policy, and if so, what is included in that payer policy, you could be setting yourself up for a denial and not being able to be reimbursed on that claim. So important. And I've seen it way too many times where that exact scenario has happened. And they have called the payer, was told no authorization is necessary. They perform the procedure, they submit the claim, they get the denial, they check the policy, and they see, oh, for this particular diagnosis or this particular product or this particular procedure, this is considered experimental, not going to get paid. So that is a heartbreak because it is something that could have been avoided. If your provider had known, maybe they would have chosen a different product or a different procedure that would be covered under the patient's plan. So you want to make sure that your patients are getting these cutting edge treatments and the treatments that they need to heal them or to get well, the treatments that your providers feel that they need. But it's very, very important to be aware of those policies. So find out who are your most frequent payers. Go out on their websites or check in your provider manuals. See if they have these policies. They will usually have them listed under medical policies or medical guidelines or reimbursement guidelines, something to that effect. And you can usually search for them on their website, or your payer representative may be able to help you find a policy if you're looking for one. And if they do in fact have a policy for that procedure or that service, go out there, look for them, maintain them, bookmark them, or print them off and put them in a binder so that you have them. Share them with your providers so that they know what the expectations are and they're aware of what's covered and what's not covered by your different payers. So, so, so important. It's very important that if they have that policy, that you check it for documentation requirements, what has to be documented in the medical record to support medical necessity for the procedure or the service that you're going to provide. What are the codes that have to be reported on the claim? You want to make sure that you are reporting the correct codes. What are the ICD-10 diagnoses that qualify for medical necessity? Are there any limitations or utilization guidelines that are included in the payer policy? Are there any credentialing requirements? Is it something that can only be provided or performed by a practitioner with a certain licensure? Are there revenue codes that you have to be aware of that you're going to be reporting? So whether you're in a hospital outpatient department, whether you are in private practice or group practice, there are so many little idiosyncrasies among the different payers in their medical policies, and they're all going to be a little bit different. So check, check, check. I cannot stress this more strongly. Check those policies, know what's in them, make sure your providers know what's in them so you can submit those clean claims that meet medical necessity, meet the payer guidelines so that you get paid the first time. Thank you for joining me today. And I want to invite you to like and subscribe if you found this helpful. Be sure and hit the bell so you'll be notified each time that I put up new content. And I would like you to visit revenuecycledecoded.com if you would like to. I have a webinar coming up on revenue cycle and how it impacts the practice with some actionable steps that you can take to improve your reimbursement, as well as a new course that will be starting up at the end of March, and that will be front end denials decoded, where I will be teaching about front end denials, how you can identify them, manage them, and most importantly, prevent them. So I hope you'll join me again on Revenue Cycle Decoded. Thank you for watching today.